Welcome to the Healing Grove podcast. I'm Dr. Kristen Ryman, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. Hi, Megan.
Hello, Kristen.
It's good to see you.
You too.
So I noticed you're sitting in what looks to be a jail cell with a broken bunk bed, and you're wearing some kind of a uniform. Can you tell us where you are and what is going on over there?
Yeah, not too far from it. I'm just kidding. I am at the hospital on a Friday night. It is 9 p.m. and it's my boyfriend's birthday, your lovely son. But here I am in a call room, just tending to the patients on our surgery team. So I'm currently in my surgery rotation and waiting and tending to their needs if they need anything or if any traumas come in.
So you could get called away at any moment. Is that correct?
Yes, if a trauma comes in, I will have to run, but we'll see. We're gonna play it by ear.
We're going to go for it. And the other thing that I want to just clarify is you are at the end of your work week, which has been how long?
Yeah, so this is Friday. This is day 6. If you count that it's a 24, then it's day 7 in a row. And I'm clocking in around, right now I'm sitting around my 86th hour.
Okay.
So
in other words, we're what's standing between you and maybe sleeping on that broken bunk bed. Is that what I'm kind of?
Correct. But there's nothing I would rather do than chat with you now. So
Really?
the bed's not that comfortable. Trust me.
All right. So for those who are new to your story, you are a third-year medical student. Can you remind us where you are and in what portion of the universe and kind of what the context is?
Yes. So I am a third-year medical student. I've just started my rotations. Last time we spoke, I had finished my pediatrics rotation, which was my first rotation. I spent 8 weeks in pediatrics, and now I am hitting my halfway point through my surgery rotation. So I've spent 4 weeks here at George Washington Hospital on the trauma surgery team. And today is my last day before I spend my next 4 weeks at the VA, the Veterans Affairs Hospital here in DC.
And how are you feeling halfway through this experience of surgery?
I'm actually feeling so motivated. I'm shocked after week 1, which was similar hours to what I'm experiencing now in the 80s of hours. I was exhausted. I was like, who would ever do this? This is horrendous. And honestly, now I'm sad to leave. I'm sad this is my last day. And I think a lot of it comes from the experiences that I've had with patients. And that's what's been my experience. I'm very grateful for my experience. I think I've had a unique one. But to be quite honest, I'm feeling energized right now, which is crazy to think because I haven't slept.
Yeah, well, it's so exciting to be learning all that stuff and to be touching lives in the way you are. Tell us about what's been unique about your experience and your opinion here.
Yeah, I mean, so much. So I'm on the trauma service, which means our patients come in and a lot of them are very healthy people in very difficult circumstances. And they come in due to gunshot wounds, which is our highest reason for trauma here at GW, motor vehicle accidents, bicycles, scooter accidents, falls, mechanical falls. So a lot of our patients are healthy people that got into an unfortunate circumstance, and therefore, when they are finally aware of where they're at, it's a really scary, confusing time for not only them, but their families as well. And me in particular, I've just gotten to know these patients really well because with these traumas, they're not quick recoveries, right? People don't bounce back from a lot of these things within days. So over these 4 weeks, I've had patients that I met day one and they're still here. Obviously, there's been some turnover, but you get to really know them and see the struggle. And I think through that, you learn how to empower them. And I'd like to talk about one particular patient that's just honestly changed my view of medicine, and actually put me in like a huge roller coaster throughout this 4 weeks. Can I share about him?
Please. Yeah.
So I'm going to use just language that's HIPAA compliant and that is non-identifiable, but it's a 21-year-old male and he was shot in the right upper quadrant. So like, sorry, this is my right. It's late. Where your liver is. So he had a gunshot wound to the liver, and when he arrived as a trauma yellow, which is our highest level trauma, there was question of if he was going to survive. He had a huge amounts of blood filling his body, and his vitals were completely unstable, and they resuscitated him. They sent him to the operating room, and they did what's called an exploratory laparotomy. So you open up the entire body and you figure out what's going on real time and you fix it anyways. So I got to see all that. Then I got to see him the next morning. Obviously, he had just become aware of everything that had happened and was processing it. And we got to do that together, at least start. He continued to recover. I would see him every day. I would spend a lot of time in his room. He knew me by name. He would light up when I came into the room, and that was really special to me. All the way up until the day we were sending him home. Now, this particular individual had to have multiple operations during his hospital course. He stayed in the hospital for 2 weeks before we decided he was healthy and could go home. I walked him down, tears from my eyes, from his mom and his grandma and him, flowers, gifts, cards, so much gratitude. It was this amazing moment. I waved him as he walked into his car and I was like, wow, this is what medicine is. Like, I get to do this, and that's such a gift. Fast forward 2 days after that high, I'm on call as I am right now, and it's 9 p.m. around what time it is right now. We get a message that this particular patient was in the emergency room. And I was like, no, that can't be true. So I actually run up the stairs, get into this room. Eyes were completely rolled back, completely nonverbal, not conscious. I'm shaking him, trying to see what's going on. His mom's in the room, very, very terrified. I'm very, very terrified, but trying to just like keep my cool. What happened? I'm just sitting there like, what could possibly have happened? When I walk out of his emergency room, I just lose it. I just completely start crying. I was able to get myself into a place where I was less seen by everyone. And I was like, oh my gosh, I failed him. It didn't work. Medicine didn't work. And this was the first time I personally have experienced seeing a patient fail whatever remedy we've given to them. And it just hit me like a train. And I couldn't sleep. I was thinking like, what could we have done differently? What did we miss? He ended up having a huge, he had like a blood clot that ruptured and then ruptured, ultimately to the point where 70% of his liver was covered in blood. So he was bleeding internally. and he went into shock, and that's why he was not responding. He went immediately into the operating room. Long story short, this patient came back to the hospital after I had told him and his mom and his grandma that he was going to be perfectly fine, that he looked so good. And I had so much guilt walking into that room the next morning with the mom in there, just thinking, is she going to think we messed up? Is she going to think we did something wrong? And I was terrified because I was putting that on myself too. I was questioning, did we do something wrong? Is this my fault? So that was just a hard experience to go through. And I'm learning from it.
Wow. Thank you for sharing that. That's a very powerful story. What ultimately happened?
So he's still here, and I still see him for hours on end. He went back into the operating room, and they fixed the vessel that had been leaking. He has a very complex medical history that includes a hole in his heart, so that if he clots anywhere, which after surgery you're at very high risk for clotting, he will send a clot into his heart that will go into the other side of his heart and can shoot right into his brain. So something we fear for him is clotting, but we also fear bleeding, because it's this dance we're trying to do right now between not clotting him but not allowing him to bleed out, which is what happened. So he's here. We're monitoring him extremely closely. We're being so delicate with him. But the rupture that had occurred has been fixed. And now we're just trying to get him back to his normal state of health and make sure that he's at the right state of being anticoagulated, but also not too far to the extreme of bleeding out.
Wow. So I wonder if you got a chance to talk with your team about this case and about his story and about your reaction to his journey.
Yeah. So this was a tough one because I was very emotionally hit by this experience and just seeing like his family and him coming back and how scared everyone was. And so we went to the OR that night, and I was standing with one of the attendings, and I just shared with her, and I said, you know, this experience is hitting me hard. What do you do in the case that, you know, your patients affect you in this emotional way? And I was told to compartmentalize. And I really don't like that. I felt like that was the last thing I wanted to hear in that moment, was to compartmentalize. It feels like a easy answer to a complex situation, and it feels like I'm just being told to shove it down. And that it was also kind of like it ended the conversation. So it didn't allow us to discuss more about the whys and the hows. It was just compartmentalized, period. So no, I didn't really get to think it through with my team. But I have a team of people in my life who I've been able to start thinking it through. And yeah, I was just, to be honest, really put off by the message of compartmentalize.
Do you think that's unique to the person who was speaking to you, or do you feel like that's a part of the larger culture of medicine?
I think that is the culture of medicine. I think there is a time and a place to process. And when I walked into his ED room and was trying my best to resuscitate and see what was going on, of course, that wasn't the time for me to process. And I agree. There's the role that you play in medicine as being there for your patient, and then there's the role you play for yourself. And I think those things don't have to happen at the same time. You have to be there for your patient first in those acute moments, but I also think that there needs to be time to think through these powerful and impactful things by yourself and with others. And I don't think there's enough of that in medicine. And I think it is a theme to compartmentalize.
And it sounds like at the moment that you were bringing this up and, making a vulnerable admission, which is that you were feeling bereft or, sad or confused or whatever it was, emotional. He was already stable, right? Like you weren't in the room with him. You weren't like in the middle of resuscitating him. You were outside of that space, still in the hospital, probably still on the same floor, but you were outside of the patient care space. But even in that scenario, the attending didn't want to go there.
Yeah, totally. I brought it to her attention in an environment that felt appropriate to me. In that it wasn't in the patient's room. He was not needing acute attention. It was now what I felt like was a good time to address my needs. I thought the patient was stable, the patient's needs were met, and I don't feel like that was necessarily how other people or how this particular person wanted things to go, or maybe has ever done in the past. But when I hear compartmentalized, I think, okay, I'm gonna put this in a box and I'm gonna think about it later. But then the next patient comes in the door 20 minutes later, trauma yellow, and you're going in there and it's worse. Okay, now I need to compartmentalize that. And then you walk into a room and something else happens. And then by the time you get home, you don't even know what box is which box and where to start. And some of them are so deep, you can't even get to them, that it makes it impossible to actually really think through these things. And that's why I think in that moment, I felt like it was more of just a rejection than a helpful comment.
On behalf of attendings everywhere who make mistakes too, I'm sorry that happened. How would you answer differently to a med student who comes to you 5 years down the line or 10 years, depending on?
I thought of this a lot because I was like, what would I have appreciated in that moment? And I also understand, I understand that the word process is different for everyone, and what that looks like is different for everyone. I personally like to think through things out loud with others. And I understand if people like to do things more internally, and maybe that was this person's lived experience. But I think if I were in that position, clearly this individual wants to think through things externally, right? I'm voicing the question. And so I would have loved some sort of validation. I think there has to be an instance in this individual's life where they have experienced something similar. Mm-hmm. And although now they might be in a point in their career where it's really easy to compartmentalize and it doesn't affect them, like I am very new in my career and it's not easy. And so for starters, I would have just appreciated some validation of, that's definitely a shared experience. I think having these emotions about, especially a patient like this, who you have gotten really close with for a full 2 weeks, is completely understandable. Mm-hmm. And then I think we could talk about different ways of processing. So I would have enjoyed a conversation about how maybe they think through things. If they like to internalize it, maybe they go home and journal, or maybe they go talk to their husband about it at home. But just tools. I just think tools would have been nice, and some validation would have been helpful.
Yeah. And so what did you do with those feelings, given that they weren't really given a space in the immediate aftermath with that attending? What have you done with those feelings since?
I have had some really, really great conversations with my close friends. And I think that that's been very helpful. Just thinking through the complexity of all the patients that we see every day and how they impact us emotionally is really helpful for being able to have a clear mind going into the next room, right? If you're thinking about the last patient, you're not you're doing a disservice to the next patient, is how I see it. One thing that I will say that I really appreciated as I continued to navigate this conversation with this attending was, we continued to talk, and she said, you need to know in medicine, like, know your strengths. And she had mentioned, like, I'm very good at operating. I can operate with my eyes closed. I can operate behind my back. I can be in the operating room and do it really well.
This is what she said.
This is what she said. And she said, my ability to communicate with patients is not my strength. That is not what I do well. And she said, figuring out your strengths and doing them really well is really important. She told me I'm going to make a great doctor because I have the empathy that I've been showing, and I've proven that I can communicate with patients, and that means a lot. So I did value that acknowledgement, right? Like, having feelings is not bad. And I think at first I was like, wow, I'm totally shut down because I'm having feelings. And that sucks, and that feels wrong. But I really appreciated when she came around to saying, maybe it's not her strength, but it's something that she sees in me that actually is going to make me a good doctor. And that felt really good.
Pretty validating.
Yeah, definitely.
And how, the level of self-awareness for her to say that, and the vulnerability, that's pretty compelling. And,
Yeah.
that's something to be grateful for too.
Yeah.
And the other thing I want to say is, I think her saying to compartmentalize might not have meant we have to compartmentalize right now. Like, that could have been her sharing her method for dealing with in the room, in the moment, which, by the way, you did beautifully. You did compartmentalize in the room with the patient, right? You didn't break into tears and lean on the mom and, ask for support from them. You held it together, and then you walked out, and then you pulled the box out and said, let's look at the contents, right? You were already doing that work.
Yeah.
Very, very powerful, Meghan.
Thank you.
Yeah, I'm really proud of you.
Thank you. Thank you. I'm proud of myself. I think there's been a lot of difficult experiences, but I really think that I have learned from them and have taken them on and like the challenge. So I'm proud of that. I really am proud of that. But I still do question some. I take a lot of things home with me, and I'm trying to figure out how to best approach that.
So what are you taking home with you?
I think I hit the bed and I think through my entire patient list. I think about everyone. And it's more just like a check-in. I don't know if it makes me feel good and I could go to bed once I've, checked all those boxes. But these strangers just mean a lot to me. And maybe that will dampen as time goes on. I'm still very new and excited about everything. And so one of my fears is that will fade, I'm sure, to some degree, but I don't know. I think I carry every little thing, because they're people with families, and I don't know. That's something I'm trying to figure out, is how to make sure it's not unhealthy.
Well, are you able to get to sleep, or are you up until 3 a.m. doing your checklist?
I'm able to get to sleep.
Yeah. So, I mean, one way to gauge it is, are you functional? Is it serving you in the same way that it's maybe serving them? Is it, causing trouble for you? It doesn't sound like it's causing trouble for you.
Yeah.
I always believed that the way I got through medicine and medical training was by loving my patients. It's not really recommended, but it's what I had to do to survive.
Yeah.
Kept my heart.
I look a little weird. I've realized that people look at me like I'm a little weird when I know every little detail, and I get super excited about them, or I've definitely noticed that. But I also don't care.
Good. Yeah. I mean, I'd rather you be a weirdo in that regard, you know, someone who's truly caring about their patients. So we were planning on doing one of these interviews after every 2-month rotation. But then when we were talking last week and I realized you were at the end of this and it was going to change next, what are you starting next week? You're starting
general surgery.
General surgery. So it's a totally different experience. You know, you're still doing surgery and retracting bladders, maybe more retraction of bladders than you're used to right now. More sort of structure and planning and clarity about what you're going in to do, and not so much exploratory laparotomies where you're looking for a bunch of wounds and don't know what you're going to find.
Yep.
So we decided to try to do them every month because it really is different, and we didn't want you to lose the closeness to these learnings and these important moments.
Yeah, I agree. It feels very real right now. Like I'm still living it right now, and it's nice to reflect on it in real time versus a month after.
So you said at the beginning you were super inspired and motivated. Do you think you want to do surgery when you grow up?
I don't know what I want to do when I grow up. I'm figuring it out. I want to do a lot of things. It's not that I don't want to do anything or I can't figure it out. It's just I want to do too much. I think the life of a trauma surgeon, I don't think at the attending level is something that I would want. I respect them incredibly. I think that being able to operate on any part of the body at any time is incredibly impressive. But it also requires you to stay overnight at the hospital at the attending level. And that's lifestyle is its own conversation. I think the operating room and what happens in surgery is incredibly fascinating. But I need to see what more general surgery. Trauma surgery, I think, is just its own niche. It feels so different than I think other surgical specialties are, because you never know what you're going to get on a given day. You never know what's going to walk in the door, and you have to be ready for anything at every minute of the day. And that's just its own animal. So probably not trauma surgery for me is my.
Now you mentioned that the attendings have to stay overnight in the hospital, but do they get a bed that doesn't have a hole in it? Or
No, they sleep right here. No, I'm hopeful that they have something a little more luxurious.
yeah. So did you choose this call room on purpose because you knew you'd be the only person in there?
Yeah.
So other med students are shacking up there, and there's maybe residents in there, and yeah.
It was a brilliant move on my part.
Yeah, well done, well played.
Broken bed. Pull the broken bed. I'll get the broken bed. It's fine.
Well, I feel like I could sit here for hours and talk to you, but I am well aware that we stand between you and a broken bed. And so, and you haven't been called yet, which means you might actually sleep a little bit.
Yeah.
Into your 87-hour work week. I mean, what's the situation right now with this? Give me the update on what's going on, like with the legislation around 80-hour work week, 100-hour work week, 120-hour work. Like, where are things?
I think you have from my understanding, in order for us to violate anything, is if we work 7 days in a row, average, you have to have 1 day off. So for every 7 days, you have to have 1 day off. But you can work 14 days straight, but have 2 days off after, and that is completely acceptable. So it's more of a, like, I will have tomorrow off. So technically I'm within that 7-day window, but it's gonna, to be quite honest, I don't know.
Yeah, that's what I recall from residency, is that they sort of created these work hour limits, but it was really an average. So you could have crazy weeks as long as the rest of the month you had lighter weeks, so that you could average it out to not so crazy, or, whatever 80 hours is per week to you, whether that's crazy or not is another story. But yeah, it sounds like it hasn't changed much.
Yeah, I think it's the average thing that gets you, because you get to the end of these long ones and you're like, oh, wow, I'm exhausted. But I think then, next week, hopefully that means I get an extra day off mixed in the bunch.
Yeah, mix in the bunch. All right. Anything else you want to share with us about life as a medical student in her 3rd month of rotations?
I think the only thing left for me to share in terms of just closing out my trauma surgery experience is I'm very grateful for this group that I worked with, because they really value teaching. And I think sometimes that's missed in teams in the hospital setting, because A, it's less efficient, it's slower to have to teach someone something. B, it requires energy that a lot of the times we're so exhausted we don't have. And C, it requires kindness. And so I think sometimes we just want to do something at the resident and attending level, they just rather do it themselves, but because they know they can get it done and not have to think twice. But I really value the teams that I've been on that are teaching forward and understand that we don't know anything, but we're paying a lot of money to be here. So please help us learn. So that's just a gratitude comment for the team that I've been on here at GW in trauma.
Have you shared that with them personally?
I did. We had our feedback day today, and I let them know that was a huge plus for me, and that's something that I really value that they provided. So
nice. And did they give you feedback today too?
Yeah, they did. And it went really well. It was awesome. I was blown away. I think that similarly to what we were talking about earlier, they recognized that I know my patients really well. I care about them, and it shows. And to me, that was great feedback. I mean, what I'm doing is being seen and recognized in a positive way. And so that felt really good. So
amazing.
that's all.
Thank you so much.
Thank you for letting me just reflect. This has been a great experience, and I'm glad I'm able to share it with you and others.
We all appreciate it, and hope you have an easy night where you get the sleep you need and are able to learn when moments of learning. What? There it is. It's calling. It's calling. Looks like cardboard. Well, listen, enjoy your last night on trauma, and we'll talk again soon.
All right. Bye.
Good night.
Good night.
I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.